Solidarity forever. Solidarity forever. For the union makes us strong.
Again. We stand forth to make sure that this department is there at the border and even inside the county to prevent these things to happen. We appreciate you. We appreciate the executive of this county, Madam Caroline, for organizing this department in prevention of polio and all these other preventable diseases like malaria. We encourage that you are going to give us the cooperation and make sure that these officers are felt to make sure that this town is clean in terms of garbage collection, in terms of sewage control, in terms of disease in schools. We are there to help you and work with this county.
Today we were in Bungoma on a very, very important function, another activity, a union activity dubbed recognition. We wanted to, advocacy and coming together to elect our leaders, our branch leaders, and formalizing a recognition agreement with the county government of Bungoma. As a public health officers and technicians union, we want to ask you to do the honorable thing. We have been lagging behind. Most of the diseases in this country, especially in Bungoma, can be prevented. Comrades, power. Power. These diseases, including malaria, including TB, including mpox, including cholera, or polio, can be prevented if we invest heavily in public health officers and technicians. The last time we employed PHOs here, I'm sure it has been a while. You have not had a serious investment in terms of budgetary allocation to public health officers and technicians in this country. We have our colleagues who retire. We don't replace them. And I wonder you are seeing the upsurge and the reemergence of communicable and uncommunicable diseases. Ukiangalia cancer iko mingi. There's a lot of cancer diseases coming up. We have a lot of diabetes. We no longer even invest in physical exercises. Nimekuja hapa even place ya kutembea is a problem. So we are actually calling upon the governor to ensure that we employ enough public health officers to take care of the population. The WHO ratios are very clear that one PHO is supposed to take care of around 7,000 members of the population. And as we speak right now, Bungoma has a population of around 1.7 million. Against around 110 public health officers in this county. Then somebody wonders how can 110 PHOs take a 1.7 million population. So we are urging the governor to employ and make sure that we have enough adequate public health officers in this county. Number two, which is very critically important, we have the UHC colleagues. Comrades, power. Our UHC colleagues have suffered, and I think health is devolved. They were promised something with the national government, but of late, tumeona propaganda ingine in the local dailies that the ministry is preparing around 6 billion to give them in terms of gratuity. We are telling you, Madam CS, and I'm telling you, I'm looking into your eyes, and I'm telling you, Madam CS, do not subject, imagine these are your children. They have subjected them to over 5 years of contracts. They have actually served over 6 years of contracts. And we agreed, the summit, the Council of Governors Summit agreed that after the 2 years, they were converting the terms of the UHC colleagues to permanent and pensionable. But it's laughable that the ministry can set aside 6 billion to give them in terms of gratuity. We are asking the ministry, and we don't want to go on strikes because these are things which are very simple. The ministry was to set up a budget for these colleagues, the UHC, to ensure that they're employed, including even the CHAP. We have a conduct staff called the CHAP and the UHC interns who were actually previously hired and they were given contracts.